All right, my name is Cindy Scudder. I'm a senior at Cactus Shadows High School, and I'm a student of Professor Browning. And today I am very honored to talk to you about infertility with PCOS. All right, as a quick overview, I want to go over what PCOS is, why it causes infertility, and the possible treatment options for it. All right, so PCOS is classified as a hypothalamic neuroendocrine dysfunction. And the main thing to take away from it is that it's an imbalance of hormones, female and male hormones, sorry. And to be diagnosed with it, one has to have at least two of the three criteria, which is irregular menstrual cycles, excessive androgens, and polycystic ovaries. Surprisingly, around 6 to 7% of women within reproductive years who are struggling with infertility have been diagnosed with PCOS. And the main focus to take away from this is that this disorder does describe polycystic ovaries. However, that is a big part of it, but the main thing to look at is also the symptoms that are associated with it. So not just the ovaries. All right, for symptoms, hyperandrogenism is an excessive amount of male hormones, which plays a large contributor to PCOS. One of the main physical signs is hirsutism, which is an excessive amount of hair caused by the androgens. And due to these excessive amount of male hormones being produced, the ovaries become polycystic, which leads to infertility. And I'll go more into detail about that later. Along with these, women with PCOS often have a higher risk of depression and other mood disorders, rising blood sugar, high blood pressure, high cholesterol levels, sleep apnea, uterine cancer, and endometrium carcinoma. All right, so insulin as a cause. It was often believed that insulin was an associated factor of PCOS. Often associated as a symptom. However, when you look at the study done by Dr. Eric Berg, he proposed that if the ovaries were removed and all the androgenisms have been neutralized, then insulin resistance would still be present, yet everything else remained neutralized. So when you look at this here, when he treated for insulin resistance, all the associated symptoms that were under it went away. However, the drugs that were used to suppress androgens neutralized related symptoms, however, had no effect on insulin resistance. So why didn't it get rid of the insulin resistance? That's because when treatments were given to neutralize insulin resistance, the treatments also helped to neutralize other symptoms caused by the high levels of androgens and amenorrhea, which is the absence of periods. So PCOS also has a 70% inheritability rate, and it's often passed down from mother to daughter. It's believed that it's a genetic defect in a post-receptor insulin signal transduction, which is the linkage to PCOS. However, if you do have high insulin levels, that doesn't mean you're going to get PCOS. However, high insulin levels is a result of the overall having PCOS. But if you have it, but you don't have PCOS, you can't get it because PCOS is strictly a genetic disorder, or genetically, yeah. All right, I'm short, so hopefully you guys can see what I'm talking about. So let's talk about how the normal menstrual cycle works. Up here, when the brain releases GnRH, it is then sent to the anterior pituitary gland. From the anterior pituitary gland, FSH and LH are then released. LH is then released to the theca cell, which is the bigger, peachier part, and from there it produces androgens, which it then meets up with FSH in the granulosa cell and produces estradiol. From estradiol, it matures the octite, which is the egg, and once the egg is matured, it's then released into the uterus and waited for fertilization. If it's not fertilized, then the uterus sheds and the girl has her period. So the difference between that one and a PCOS menstrual cycle is it does start with the GnRH, where the brain releases abnormal amounts of GnRH, and then these abnormal amounts are irregularly sent to the anterior pituitary gland. So that results in higher levels of LH, which is then sent to the theca cell and produces higher level of androgens. These androgens have a negative feedback, which results in they produce estrone, which then has a negative feedback on FSH, preventing it from getting to the granulosa cell. And when that happens, estriol is not produced, so the eggs cannot mature. And what happens when the eggs cannot mature is they go through cystic, this is why I have notes, okay. They go through cystic degeneration, and when that happens, the follicles begin to degenerate, and it's resulting in follicular cysts, which is where the polycystic ovaries come from. So, yeah, basically, that's what prevents the girl from having her period. And so the best chances of pregnancy, there are a couple of medications you can take, including ovulatory stimulants, which include clomiphene. These are generally used when trying to get pregnant, and they're probably the most popular fertility drugs. Generally, it prevents normal feedback inhibition and increases the release of LH and encouraging FSH. Then, and androgen synthesis, the one for that is ketoconazole, and this drug functions by inhibiting desmolase in the theca cell. This can also be used to treat hirsutism, which is the excess amount of body hair. Then insulin-lowering agents used to improve metabolic symptoms and decreases chances of cancer. And the most common form of that is metformin. It's frequently used to help insulin's ability to lower androgens and blood sugar. Then there's aldosterone, Anyhow, the one over in that corner, and it decreases the number of androgens. It usually works by competitive inhibition of androgens binding receptors. So spironolactone is the most common form of that, and it focuses on inhibiting steroid binding and is often also used to help treat hirsutism. And then, along with oral contraceptives like that, there's also other options that they can use to help increase your fertility, and a medical procedure which is assisted reproductive technologies, is in vitro fertilization. And what happens with this is the egg and the sperm are fertilized outside of the mother, and once they are fertilized, it's then placed back into the mom, and it's implanted itself and will develop. But the good thing about this is that the egg and the sperm chosen are already healthy, and they're put in a spot where the sperm cannot have gone on their own, because oftentimes with the imbalance of hormones, the sperm don't always make it to the cell, so that often results in not getting pregnant. And along with that, regular diet and exercise are highly encouraged, as long as with maintaining insulin resistance management. All right. So while doing the research, I've learned what causes these hormones to react in the way they do, and understand how they relate and influence symptoms of PCOS. As PCOS is becoming increasingly more common, more women are being diagnosed with it, and it's has a better understanding of what they're being diagnosed for. Although, sorry guys, I did talk about periods, but it does kind of involve you too, because one day maybe some of you will want to become fathers, and you need to have a bit of understanding for, say, your partner, if she does have PCOS, why you guys are struggling to have children. So hopefully the more people are informed about PCOS, the sooner they can seek help. And with that, any questions? Yeah? Yes, it does. Not all the time, but it does increase your chances rather than a person who normally wouldn't have any or doesn't have PCOS. Yeah? I couldn't find anything on that. However, it is genetic, so more people are passing it down, or maybe more people are just like coming out about it. And so it's getting more awareness, and maybe there was a lot of it back then, but now people are just more aware of it, so the population is growing. Any other questions? Yeah? Mm-hmm. No, obesity is a symptom of PCOS. People can be obese if they don't have PCOS. However, PCOS increases your chances of being obese because of the interactions it has with adipose tissue. Any other questions? Yeah? Thyroid PCOS. I actually can't answer that one because I didn't research that one. I just did general PCOS, so sorry about that. Any other questions? You in the back? Like having PCOS? Generally, it doesn't. I mean, my mom had PCOS when she carried me and my brother, and me and him are perfectly fine. Generally, it just affects the girl trying to get pregnant because, like I said before, it's all the hormones that are mixing are not allowing like the eggs to mature and like go into the uterus. So it's more just with like getting pregnant but not maintaining pregnancy. Yeah. I would say it's probably one of the most common. In fact, I think roughly about 20% of Americans have PCOS, and it's like anybody can have it, like regardless of background or like race or anything. Yeah.
I noticed that you have some medications there. I noticed, like I talked about in the fertility session, there are any other methods that female or couples going through, trying to get pregnant and not being able to then have in order to actually get pregnant.
Like aside from the medications that I
Yeah, aside from the medications and the fertility session, there are any other methods.
As far as I know, it still could happen naturally. However, the chances of that are very low. So it's best to, if you are in a situation like that, is to get help, because oftentimes the female's body will just not accept anything, and you're not going to get pregnant. So generally, also like maintaining healthy weight and exercising does help a lot with PCOS. But you can never fully get rid of all the symptoms. So I would stick to trying some of them. And if none of them work, then like the previous one, you could do the assisted one, and that should help. All right, any more questions? All right, thank you all so much.